So today I'll be telling something about skin lesions. Skin lesions. So basically, the lesions in skin diseases are described in various terms, and today I'll be discussing regarding those terms. So skin lesions are basically of two types. So one is primary skin lesions, the other is secondary skin lesions. Okay, primary and secondary skin lesions. Primary lesions are those lesions which are part of disease process, result as a part of disease process. Whereas secondary skin lesions, they are not part of disease process, okay, but they are as a consequence of um, trauma or infection or patient's activities, because of which primary lesions change to secondary lesions. So primary lesions occur as a part of disease process, whereas secondary lesions are not part of disease process. They evolve from the primary lesions. Coming to the primary lesions. So primary skin lesions may be of various types. The first one is a macule. So all of us know macule is change in color of the skin that is less than, let's say, less than 1 mm, less than 1 cm, less than 1 centimeter in size. Less than 1 centimeter in size, we call it macule. So if the macule grows, if it grows more than 1 centimeter, we call it patch. Similarly, the macule and patch, so these are non-palpable, they are simply change in color. So if the lesion becomes a bump, if it is raised and small, we call it papule. If the papule grows horizontally, if it becomes larger, flat and larger, we call it plaque. Okay, so it's plaque. If a papule enlarges horizontally, becomes larger, we call it plaque. Whereas if the papule grows vertically more instead of horizontally, we call it a nodule. The papule, plaque and nodule are solid. So instead of solid, if the raised lesion contains clear fluid, we call it a vesicle. So vesicles are small raised lesions on the skin that contain clear fluid. If the vesicle enlarges, then it will become a bulla. So bullas are usually present in immunobullous disorders. If the papule are raised lesions that are solid. Plaques are raised solid lesions that have longer horizontal diameter. Nodules are solid lesions which have bigger vertical diameter, not the horizontal. If the horizontal is large, we call it plaque. If the vertical diameter is large, we call it nodule. Vesicles are also raised lesions, but they have clear fluid. Bulla have also clear fluid, but they are larger than vesicles. So the next is pustule. Pustule is also a raised lesion, but it contains pus. So it contains pus instead of clear fluid. If it was a clear fluid, we will call it vesicle. If there is pus, we call it pustule. So the other one is wheal. So wheal is also a raised lesion. It's commonly known as hives. It is usually present in urticaria and it is itchy. The other one is telangiectasia. Telangiectasia. So telangiectasia is a dilated vessels, dilated cutaneous vessels. Cutaneous vessels. You can see it in the perinasal area around the nose in some people. Similarly, sometimes RBCs get deposited in the skin. So these blood depositing in the skin may present themselves as petechiae, purpura, or ecchymosis. Petechiae are pinpoint and ecchymosis and purpura are larger in size. Even hematoma, that is collection of blood, can be called a primary skin lesion because it is part of disease process. The other primary skin lesion is burrow. Burrow is seen in case of scabies. And the last one is comedone. Comedone is seen in acne and presents itself as blackheads and whiteheads. Okay, blackheads and whiteheads. Okay, so this is about the primary skin lesions. A total 16 of them are present. The other skin lesions are secondary skin lesions. Secondary skin lesions are not part of disease process, but they are as a consequence of trauma or infection or as a consequence of patient activities. These are formed from the primary lesions, and they may be like scales. So scales, these are flaking of the skin and can be seen in psoriasis. The other secondary skin lesion is crust, as seen in impetigo. The other one is excoriation. These result because of scratching of skin, as in case of scabies. So in scabies we also saw burrow as primary lesion and excoriation as secondary lesion. The other one is lichenification. Lichenifications are seen in lichen simplex chronicus, and lichenifications is a triad of skin thickening, hyperpigmentation, and accentuated skin lines. So the other secondary lesion are fissure, erosion, ulcer, sinus, scar, atrophy, dry. So fissures are linear and the edges are vertical. They are either representing chronic hand eczema and chronic foot eczema. Erosions result because of loss of epidermis. Loss of epidermis. Usually in case of bullous disorders or drug reactions. In case of ulcer, there is loss of both epidermis and dermis. Loss of epidermis as well as dermis. Sinus is a blind tract that communicates with a cavity inside the body. Scar is formed when an ulcer heals. Atrophy is decrease in volume of a tissue. So it may be epidermal atrophy or dermal atrophy. Stria are formed as a result of one of the reasons is as a result of atrophy, and usually because of stretching of the skin. We must have seen stria in case of people who go to the gym. If you go to the gym and carry heavy loads, you may develop stria, or in case of belly of pregnant women. So these stria also may be of various types. So this is our discussion here. So the skin lesions may be primary or secondary, and we have 16 different types of primary lesions, and the rest 11 types are secondary lesions. Thank you.